Hello friends, have you ever heard subarachnoid bleed or aneurysm in the blood vessels? You know, there are two main blood vessels supplying the brain. That's called the carotid system as well as the vertebrobasilar system. That means the front part of the brain as well as the back part or hind part of the brain. So, due to some flow related hemodynamic stress or something, the vessel can get bulged out. This is called aneurysm. Basically, three types are there. One is a berry aneurysm, or there is a fusiform aneurysm, or there is a dissecting pseudo aneurysm. So, our main concern is regarding the berry aneurysm. Berry aneurysm is something like a bulbous protrusion of the deficient muscularis layer and rupture of the internal elastic lamina. There are three layers in the blood vessel. There is the intima, media and adventitia. This can bulge out. The intima can bulge out through the deficient media to the adventitia and cause a dome as well as a neck. The neck may be small or a large. It can be a dome, it can be a body, okay, and there's a height and breadth and there's a neck will be there. So, usually this occurs as the bifurcation or the branching points of the arteries, because the artery, it won't go directly straight up. This divides into multiple branches. There are various named branches are there. So, whether it's anterior circulation or in the posterior circulation, this gradually enlarge over the period of time, maybe 5 years, 10 years, 20 years or 30 years, and finally it reaches size. When it reaches beyond 4 millimeter or so, this can rupture because this doesn't have the full layers of a normal blood vessel. There are so many factors which would lead to rupture, like smoking, hypertension, more hemodynamic stress on the blood vessel, and once it ruptures, usually rupture occur at any size can rupture, but usually this occurs above 7 mm and say 6 mm or more. Once the size is 7 millimeter, the size of the aneurysm is 7 millimeter, there is a chance of 1% rupture per year. And if it is reaching 2.5, can have a giant aneurysm called more than 25 millimeter. The chance of the rupture rate would be around 2.5% per year. That means if you don't treat for 10 years, the chance is around 25%. This is called a cumulative rupture rate. Okay, so there are certain conditions which would predispose, like if there is a polycystic kidney illness, or if it's a bicuspid aortic valve, or if the patient has got abnormalities of the blood vessel like fibromuscular dysplasia, Marfan syndrome, pseudoxanthoma elasticum, neurofibromatosis, sickle cell, familial intraocular aneurysm, coarctation of aorta, AV malformation, fenestration of the blood vessel, some anomalies or some biochemical abnormality like increased elastase, or if the type 3 collagen is deficient, or if the lipoprotein A is increased, or if the alpha 1 antitrypsin deficiency is there. In all these cases, they can have a this aneurysm can get formed. Similarly, certain conditions like a trauma, infections, malignancy, drug abuse can also predispose to this sort of aneurysm formation, especially bacterial endocarditis. The septic emboli can go to and dislodge in a vessel at a branching point or somewhere, and this damage, there will be a necrosis of the vessel, and there can be a pseudo aneurysm can get formed, and this would lead to rupture and bleed and death. Okay, so what are the symptoms of a subarachnoid bleed? The classic 95% of the patient gets a sudden severe catastrophic headache. It's the worst headache in their life. They tend to fall down, they get a coma, or it can be mild, moderate or severe. And if you take a neuroimaging like a CT scan, you get a blood around the brain or around the various cisterns. So, depending on where the maximum blood is, you know that there is a rupture of this artery, because there are so many branching points. You can have anterior communicating artery, posterior communicating artery, MCA bifurcation, ICA top, basilar top, and any areas like ACOM or DACA or PICA or SCA or the various branching points or different arteries. So, there are many locations there, mainly anterior circulation 90%, posterior circulation 10%. So the investigation choice is CT brain, and if the patient has got severe sudden headache, it is normal, immediately you have to do a CSF study to rule out a subarachnoid bleed, because the mortality is quite high. Once the aneurysm ruptures, 1/3 won't reach the hospital, and the mortality will be in the tune of 50% if you don't treat the patient. So, if there is two modalities of treatment, there is no observation, no medical management. The two things are: one, you do a coiling, you take a catheter right through the one vessel called a femoral artery all the way through the aorta, and you select the vessel and find out where the aneurysm is, and then you put a guiding catheter into the major artery, and then the distal access catheter. Finally, by a microvere and micro catheter, you enter the aneurysm sac and you coil with some thin hair like fibers, what called coils, GDC coils. That's a detachable Guglielmi soft coils. There are many types of coils are there. So you fill the aneurysm sac with this thing, but if there is a wide neck, then you may have to do a stent assisted coiling, or you have to, or you should have a so many other devices are there. There's a web is there, many things are there, or you stent assisted coil is there, or you put a micro catheter coiling. Many things are available. So or the other option is you clip the aneurysm with a metal clip. That's usually done by the neurosurgeons. The coiling is done by neurologists, neuroradiologists, and in some centers neurosurgeons as well. So as I told you earlier, the symptoms are sudden severe headache. So sometimes they can be a multiple cranial nerves gets affected, and they can have a ptosis or squinting, or sometimes they come with a fit or a seizure or a convulsive movement, or they can have mass effect, or somebody can have recurrent bleed, one more bleed, because if they bleed once more, the chance of coming back to life is extremely rare. Recurrent bleed. Okay, then they can come with a stroke, because this sac, the aneurysm sac, sometimes lodges some clots. Because of the effect of the blood flowing into the aneurysm, some of the clots can get dislodged to the brain and causes TIA or a stroke. So these are the various problems with the various presentation of subarachnoid bleed, and the chance of rupture is 1% per year once the aneurysm already bled. Or if it is an unruptured aneurysm, the chance is around 1% per year, and if the size of the aneurysm is more, this is 2.5% per year. So the investigations are CT or a MR angiogram, contrast MR angiogram, or a CT angiogram. But the angiogram, the cerebral, the proper DSA or the digital subtraction angiogram is the gold standard, where you can you can know that there are multiple an aneurysm, any abnormality of the vessel, any stenosis, the morphology of the vessel, whether the anatomy is favorable for coiling or clipping, everything can be, or the collateral circulation or the vasospasm, anything can be made out clearly in the DSA or the digital subtraction angiogram. So this is in short regarding the cerebral aneurysm or causing subarachnoid bleed, the various manifestation, the investigation, and the treatment. Treatment would be basically endovascular, or taking the catheter up and filling the aneurysm, or by a clipping, by you clip the aneurysm. These are the two ways. So I hope I could tell you at least some ideas, some aspects regarding the subarachnoid hemorrhage and the various manifestations. So let me conclude here. Thank you very much.